Welcome to What the Mom podcast. You are listening to Doulas Petra
and Jacqueline.
Motherhood can be isolating and hard.
We are two doulas who want to provide a safe place to talk about all things mom,
From pregnancy
to birth,
to postpartum.
to parenting.
Join us as we have real conversations about real life.
Welcome to What the Mom podcast.
You are listening to Doulas Petra.
And Jacqueline.
Thanks so much for joining us today.
Yay, we're together.
Woo! Cheers.
That doesn't always happen, so it's exciting.
Hopefully you're somewhere comfortable, and if you're at home or somewhere safe, not driving, pour yourself a drink. If you need to pause this to go do that, then do that.
Yep.
We're drinking bubbly today.
Yes, we are.
No wine for a little while.
So, starting to show. What are you?
15 weeks now,
Oh
so
my god.
second trimester.
It's crazy. I feel like we just announced that you were pregnant. It's wild.
We kind of did.
It's just crazy. Time just flies.
But I'm feeling good, so.
No more tiredness as it was as bad, right?
Yeah, the only thing I really had was I was really tired.
In the first trimester.
And I was peeing all the time.
Which is normal. But when you have 4 children, those things can be a little bit tricky. So I'm glad you're feeling better though.
Yeah. So today's topic is
delayed cord clamping.
This is something we both practiced. We encourage other mothers to do the same.
There's so many health benefits.
Lots.
For sure.
So that's what we're going to share about today.
Yeah.
So we took a few notes just so we don't forget any of the important points.
And I will forget everything. So
Not with your notes.
not with my notes. So I'm going to read from my notes.
So I guess the first thing that we should talk about is, what is the umbilical cord?
Yeah, totally.
The umbilical cord is what connects the baby to the placenta. It's literally just the cord. That's what people make jokes about, when are you going to cut the cord already? When people are connected to mom, because literally in pregnancy, it does connect the baby to the mom.
Yeah, it's so cool.
It is amazing
how our
works.
Bodies nourish our children that way.
It is, yeah.
So cool.
And the baby's blood circulates through this umbilical cord.
Mm-hmm.
So it's through the baby's body, and then through the umbilical cord, and then to the placenta, and then back again.
Yeah.
And that helps the baby receive the oxygen and nutrients from the mom, because the mom's blood also goes towards the placenta from the other side.
Yeah.
Which
so
is
cool.
Truly amazing.
It's the neatest thing ever.
And that's why people can actually find out if they have some chromosomal, is that how you say it?
Chromosomal, I think. I don't know.
You guys know what we're trying to say.
Chromosomes.
The abnormality with the chromosomes. It's midnight, we're recording, okay?
Who would have thought that was a tongue twister? I never would have thought that was a tongue twister until you said it. So,
leave it to me.
Thank you for that.
You can find
Just like you said. Go watch your other episode. Which one was it? She was trying to
relax
slow, relax breaths during labor, and then she said slow, relax breaths, and it was the funniest thing ever. And now I guess chromosomal is hard to say.
I don't know why.
I digress. Anyways. Hope you had a good laugh.
You can look for the abnormalities in the chromosomes. You can look for even the DNA to find out the gender of the baby.
So neat.
Through a blood draw from the mother.
Really, I didn't know that. That's really cool.
So, what do they call it? The N. Oh, I can't remember right now. The nuchal testing or whatever.
Okay.
You can do testing in the first trimester with blood work to check for this stuff. And you can also, in the meantime, find out the gender of the baby. There's also some companies that don't go, it's not through your healthcare provider, but you pay out of pocket.
Oh, okay.
Like Sneak Peek is the one that's most popular.
Mhm.
And they send you something in your home.
Really?
I did that with Juliana to find out her gender.
Really?
You didn't know this?
Did you tell me?
I thought I did.
Maybe you didn't.
I
Wow,
don't know.
that's cool.
So they send you this kit. You
Okay.
pay for it. They send it in the mail. And
We do this from home.
they have these instructions about like cleaning because you can't have any DNA that's anyone else's at all, especially male DNA. Because basically it's checking for the male chromosome.
Oh, okay.
So whether it's there or if it's absent.
Okay.
So you could get a false male
Yeah.
if you have contamination from male DNA in your
That
house.
makes sense.
So they have this routine. They say don't do it in the washroom because there's a lot of DNA in there. They give you a little scrub
Men
brush.
pooping in there.
Yeah, spending all their time. They tell you like wash your hands, clean the area that you're going to be using the table or whatever, and then they give you a scrub brush, scrub under your nails.
Really?
And then you
did tell me.
You have a little poke thing, kind of similar to like what people do with diabetes. You poke your finger to get some blood and then you squeeze a few drops of that blood into this little tiny vial.
So that's how you found out.
And then you mail it back to them.
That's how you found out you're having Juliana.
Yeah.
Wow.
And they can do that as early as, don't quote me on it, but I believe 9 weeks. Like really early.
Really?
It's amazing.
I didn't know that. That's really cool.
It is actually really amazing. So anyways,
that's really neat.
But you can also do it through the blood work that's done like in the labs, like through your healthcare provider and stuff too.
Yeah. Wow.
But that's people who just want just for the gender, they do this. But anyways,
that's cool.
The whole point of that was it's because the way the blood
is how
is circulating between like the placenta is that barrier between mom and baby, and both of them have their blood going into that placenta.
So that's how you can tell.
And the baby's getting the oxygen through mom's blood, getting nutrients through mom's blood. So your baby literally eats what you eat.
It's the neatest thing.
Yeah.
It really is.
It is really, really cool.
So cool.
A full-term baby may have as much as 1/3 of its blood in the placenta when labor begins, which is actually a lot.
Oh, that is nice.
Then as labor and birth continue, the placenta transfuses most of the blood back to the baby, knowing that the baby's going to be birthed soon. And then after the baby's born, this is what we actually see, that umbilical cord will continue to pulse. And that pulsing is continuing this process of transfusing or moving that blood back to the baby away from the placenta. And when you wait for it to stop pulsing and all that blood goes through, that can actually be enough blood to supply a baby with iron for approximately 3 months of their life.
That's really cool.
Which is really amazing, actually.
I didn't know that. Yeah, there's so many different benefits to doing it.
There is. So how long?
Oh, okay, so they
do you think we should do?
Say optimal time to cut the cord will depend on your circumstances.
Yeah.
If it's, I mean, it depends. But if like baby is like having trouble or whatever, they might be like, oh, we need to cut the cord quicker. Like, didn't you say that they did that with you?
Yeah, with Katerina.
You told me that because she pooped. She pooped. See? So that depends on circumstances.
Yeah.
So you were also in the hospital. You had a midwife still though.
Yeah.
But I mean, yes. So that would be a circumstance where they would be like, okay, that could be dangerous, so they'll do it faster.
Yeah.
So they can suction the baby and stuff. But they say typically it's like 1 to 3 minutes after delivery, and then it allows the baby's blood to return from the placenta into the baby. And that absolutely can be beneficial because, like she said, like that can supply them with
the
iron stores for like 3 months. So I would say if you can do it and you can do it safely, I would say it's a really great idea. But then, I mean, you just always have to look at if there's risks and stuff, then you obviously want a healthy baby. So I understand why you had to.
Yeah. It is really cool watching it though, because when the baby's first born, it's like this dark like purplish color
Wow.
almost, right?
Yeah.
And then as you wait, it starts to become more white and almost like
Yeah.
dead looking.
Ah,
Literally.
It looks dead.
I don't know how else to describe it.
Because it's alive. Like it's
Because
the
there's
coolest
blood in
thing.
it at first, and
Yeah.
then it's going through, and then
It's the coolest thing ever.
it just and it's moving because it's pumping
Mm-hmm.
the blood, and then it like just stops.
Mm-hmm.
It's really amazing, actually, if you pay attention and you watch it.
Yeah. I didn't pay attention as much this time with Lorelai because I was just in a whole another
It was a
world.
different experience.
It was a different experience, and it was in the hospital. But I remember seeing the cord with, I believe it was Ben, because Sophie was born at night, and so we didn't have lights on. It was kind of like,
Yeah.
the ambiance was dark. There's really nothing there. Couldn't really see anything.
Yeah.
But yeah, I remember seeing it with Ben, and it was so cool.
It is really cool.
Seeing it turn that color so quickly too.
Yeah.
It's crazy.
It's true. It also, like, allowing the blood to go through and waiting, that also increases the hemoglobin levels.
Yeah.
Which, like we said, it improves iron stores in the first several months of life. But that can, well, on a positive note, that can reduce the risk of anemia.
Yeah.
But on a negative note, there is a small possibility that it can increase the bilirubin levels, which causes jaundice. So then you just have to keep an eye on the baby. But it's very, very common for babies to have mild jaundice at birth. Anyways.
Very, very, very common. Yeah.
So what your healthcare provider would do is just keep an eye on them.
Yeah.
Watching, and they'll know like what to look for. But basically, it's like yellowish eyes. The skin looks a little bit yellow, even.
Yeah. Because then it can affect their liver. Yeah.
Yeah. But you combat that by breastfeeding lots and getting vitamin D, whether it's directly from the sunshine or giving supplements to the baby.
Yeah. Absolutely.
And if it is bad, then they would put the baby under special lights. Yeah.
Yeah, my nephew had to do that.
Yeah.
None of my kids did. They had a little bit, but not a lot.
Yeah.
Not anything to concern the midwife. So yeah, it just depends.
So
and I'll look for it.
Yeah. Delayed. See, I can't talk. Delayed cord clamping.
Wow, that's a new word.
Delayed cord clamping does not automatically mean that your baby's going to have jaundice, though.
No.
It just means there's a higher chance that they can.
There's a chance that it could be. Absolutely.
Yeah. Because like you said, you didn't experience it, and you did delayed for yours.
No, I didn't at all. And so I guess every baby's different. Every situation's different. Every birth is different. Also, I didn't know this, but leaving the umbilical cord intact for at least 2 minutes after birth might actually reduce the mortality risks of premature infants by as much as 69% compared to immediate cord clamping.
Wow.
So if you hear these things, you have to do your own research. You have to be your own advocate. If you're learning about these things, you're like, oh wow, obviously, you know, like to me, that's just like a thing where I'm like, oh my goodness, that totally outweighs the risks for me.
Yeah, exactly.
Like that's huge.
So then that means that it's beneficial for both term and preterm infants.
Yeah. So that means that it's really good blood in there.
It's just something we should be doing.
Yeah. That's really cool. I had no idea until I looked that up. But.
Yeah. And in preterm infants specifically, so that's like one thing alone that's reason to do it.
Yeah.
But it also creates improved transitional circulation in a preterm infant.
I didn't know that. That's
better establishment of red blood cell volumes, the amount. Decreased need for blood transfusion.
Yeah.
Decreased incidence of fetal hemorrhaging.
Which is huge. I mean,
like these are just all things that I mean, you have a preterm baby, you already are at higher risk of a lot of things.
Mm-hmm.
So why not try to do delayed cord clamping
If you can.
for all of these benefits, if possible? Yeah.
Absolutely. There's always going to be, they say something that, like the bilirubin or whatever, there's always going to be like something, you know, that's going to be not the greatest that could happen. But
yeah.
if you look at all these reasons, it makes sense if you can.
Yeah.
Absolutely, I would rather do that.
It's true.
Yeah, it's like it has tools to help you preserve your baby's cord blood and delay the cord clamping. Like there's so many amazing things that it can do. Also, a lot of people, they do the banking. So if your baby were to need stem cells because they have cancer or something, they say that the stem cells, they're not used specifically for treating the cancer, but stem cell transplants, they don't act directly against the cancer, but they can restore your body's ability to produce new blood cells after treatment. And that's one thing. You have really low blood cell stores like after you've had chemo, because that's just what it does, right? It's killing the good blood cells and the bad. So yeah, it's been actually helping people, help them through like really intense treatment and stuff. So I mean, that's pretty cool too. So there's that option too, if you do want to, you know, keep it.
Yeah.
And leave it.
The only thing to remember about that though is you cannot do the delayed cord clamping.
You can't. You can't.
You can wait. I can't remember how long they say, like a little bit, but it's not the full.
Because they
time.
want
They need that blood that's going to be transfusing through.
So I mean, there's a lot of options.
Yeah. You weigh the pros and the cons for what you think is best.
And there is always going to be pros and cons. I don't think there's, you know, you're gonna know right away. Mm-hmm. That's why it's like, be your own advocate. There's so much information.
It's true.
There's so many books. You can talk to doulas like us. You can talk to lots of different people. And you found all of this, like you find it all online. Like all the information is there.
Yeah. And
you just have to look for it. I mean, I had no idea. That's so cool about the mortality risk in premature and babies. Like mortality, like passing away. That's a really high number. So
it's crazy.
To me, it's like, well, yeah, that definitely outweighs the risk. So
it is true.
Yeah.
I know they used to cut the cord, clap and cut like right away, because they were worried that the mom would hemorrhage if they didn't. But this is another one of those things where there's a way that they did things for many years because they thought something happened, and then turns out, oh, I guess that's not actually the case. And so now studies have actually shown that delayed cord clamping does not increase the risk of postpartum hemorrhaging. Yeah. So your risks for hemorrhaging are not going to change depending on if you are cutting the cord right away or not, basically.
Yeah. Which is also a really big thing too, right?
Yes.
Nobody wants to hemorrhage either. It's not fun. We both had that happen, and
it
is not a fun place to be.
There's many other factors that can contribute to that, but this is not one of them.
Absolutely. Yeah. There's lots of information.
Something else that some people do as well is they do what's called lotus birth.
What? What's that?
You leave the placenta connected to the baby until it dries off on its own.
Okay, I have heard of that. Yeah.
And people who do this usually do it because they're wanting something that feels more natural. They want it to be. They consider it less traumatic, however you want to say it. Maybe it's because they feel like it was a part of the baby and the baby's been attached to it, so they want to wait for it to be something that naturally happens on its own. So people who do that, basically you don't do any kind of cutting, burning, nothing to the cord. All they do is they have some type of bag or basket or something they put the placenta in,
Mm-hmm.
and they use a mixture of dried herbs.
Wow.
So that it doesn't start to rot or stink. And so these herbs,
and they stink.
It would stink on it if you just left it on its own, because it's an
Oh.
organ left out, right?
I left that. Yeah, I learned my lesson with that.
But if you use the right mix of herbs, it
That makes
actually
sense.
helps
It could
keep the
help.
smell away. It helps it dry out faster.
That could help,
Yeah.
absolutely. I made the mistake because it was our last baby. I'm like, I'm going to do this really cool picture where you like have the placenta and you attach it, you know, like you pretend it's attached to the baby and you make a heart or you do something like that.
Yeah.
And so I took the placenta out. It was freezing when I had my daughter. So it was outside in the snow in this little bucket. And I take it out and I'm like, oh, I'm feeling good about this. I'm going to do it today. Wouldn't get to it. So then it like stunk. So I'd have to like freeze it and oh my God.
Oh, gross.
Thaw and refreeze it. And like, oh, the smell was awful. I remember poor Sophie, she helped me do it. And I thought it was so cool. It turned out to be a really cool picture.
Yeah.
But the smell is just, oh, it is awful because it's an organ. So it's not going to smell really pretty.
Yeah.
And the thing is, I didn't hemorrhage with my last daughter. And I wanted to have it as a memoir, whatever. Like, I wanted to have it a momentum. I wanted to have it as like saying, I actually had the chance to do that because the last ones came out in pieces because I hemorrhaged and they didn't detach properly. And so this one was fully intact, and I just thought it was the coolest thing. And I just I needed to have a memory of it because it did me well this time. But yeah, the smell, do not thaw it and then refreeze it. It's awful.
I wouldn't advise that either.
Oh, it stunk. Have you done anything weird with your placentas? At all?
What do you consider weird?
I don't know. Okay, my mother-in-law thought it was the most disgusting thing ever. I'm like, why? I think it's so cool. And she just kind of laughed. Disgusting? No, then I like took a picture with it.
Oh.
She was a little disturbed.
I've seen
everybody has their opinion, but
there's a lot of things that you can do with the placenta
cool.
after, though, right?
Yeah. Like some people encapsulate it. I don't know. There's old wives' tales. They say that it helps with postpartum and all this stuff. But I don't know. I've talked to a few midwives and they say, I don't know if it actually does. But I never ate my placenta. I know lots of people who do. But again, it's your choice. I just wanted a picture. I just thought, hey, like this is neat.
Yeah.
But it obviously wasn't for everyone. They all thought I was weird.
That's exactly it. I did encapsulate it for my first two.
Did you? Did you notice a huge difference?
Okay,
like,
so
really,
my first.
Be honest.
My first, I thought it helped.
Really?
Because I had a really good postpartum experience. My milk supply was amazing. I didn't have any postpartum depression. I was very attached to the baby. Like, it was good. So I thought maybe it was from that.
You thought maybe. And maybe it could be.
Then with my second, I did it again because I thought it was a good experience. I'll try again. But then I had really bad postpartum depression still. My milk supply was good. But I didn't know if that was from that or not. Yeah. So then I finished, I took them all because I already paid for it and stuff. But
yeah, it's not a cheap thing to do.
Because you have to dehydrate it and put it in capsules and stuff.
Can't remember how much it costs. But
so then I was like
a couple $100.
Yeah.
Oh, yeah.
And then I thought to myself, I don't know if it helped enough, or there's also depends on how they do it too.
Are we talking 1 to 200, or how much is it?
It was 2 or 250.
It's a significant amount. So if you're gonna do it, you might as well.
Or
just toss it in while
some
you're
people, some people swear by it. Other people will just eat the placenta, literally just on its own.
Just eat
They'll add it to some food, cook it. Some people will just put it in a smoothie.
You do you.
Yeah.
You do you, but I will not.
I talked about it and I was like, no, I can't.
Oh my gosh. I couldn't.
But I know I know a couple of people who do
Really?
that. Yeah.
Yeah.
One thing they do say is that if you are hemorrhaging
Okay.
and you don't have, like, maybe you had the baby before the healthcare provider arrived or something, right? And you're hemorrhaging, they say take a little bit of the placenta and honestly, like, just chew it in your cheek because of the hormones and the iron,
Shut up.
and everything that's in the placenta.
It can help you stop hemorrhaging.
Yeah. It can stop hemorrhaging. And so there are like so many people who was like, yeah, I was doubtful, but I was in, like, it was an emergency and I had,
And they just tried it.
so they tried it. They just took a little and you just chew it in your cheek and then it'll stop it apparently. I mean, I don't have experience with this. This is what I've been told.
Really? I've never heard of that.
So
I hemorrhaged twice.
in an emergency situation, it's worth trying.
Give me a piece of the placenta. I'll make chew on it. Doesn't work if they chew on it. It has to be you.
Yeah, it has to be you. The mom that's hemorrhaging.
But I mean, that does make sense because
Yeah. I mean,
it's an amazing thing.
If you were by yourself, you have no medication, you have nothing else. I mean, what would you do, I guess?
What would you do to save your life?
Yeah.
Chew some placenta. I guess. I don't know.
Yeah, exactly.
I didn't know that. Wow.
Which I thought that was so crazy. Like,
that is so cool.
Like, cool, but weird at the same time, right?
I could see that happening though.
Yeah.
I could totally see that because it like gave your baby life and yeah. Why would it not save yours? You know?
Yeah, exactly.
So cool.
So then some people do like what you did. They take pictures with it. There's some really cool picture ideas that you can do.
My friend did art with hers. She did.
Yeah, that's what I was thinking I might do this time.
She did. Yeah.
So you can either like do like a print.
Yeah.
So it's like you can make like the tree of life kind of idea, but it's the placenta, right? Yeah. This is what gave my baby life. So you can put it on a paper and have like the blood make the print, or some people wash it and then they put it in paint and then make the print, and then you get to hang it up. You frame it, hang it up on your wall.
Yeah, because it gave your baby life. Yeah. Like it's.
I was thinking of doing that this time.
Amazing thing.
Baby number.
Remind me not to come over.
Baby number.
Or have Sophie come over and see it and be like, Mom, she's doing this. Yeah, she's kind of scarred, but it'd be fun.
Baby number 3 and 4. I kept the placenta, but then I just did it like.
Did you just leave it in the freezer? And
for
you would just look at it and you didn't do anything with it?
I did it like an educational time.
You're like, this is where you live.
So I asked my older children, I'm like, would you guys like to see what the placenta is like? Because we talk about birth and all the parts of it and what happens and how the placenta is there.
That's where you lived in.
Yeah. So then I hold it up and like, so you hold up like the sac, and I'm like, so this is like the amniotic sac, and this was closed over top of the baby, and there was the fluid inside.
Crazy.
And then you can see like this big open area where the baby would have been. And
where the baby would have been.
Oh, that's really cool.
Like crazy.
And then you can show her, this is the part that was connected to mom. And this was on my uterus, literally.
This was like stuck to, it's just like.
And that's why mommy's bleeding now, because this came off and had to come out. So now I have a little wound that needs to heal on itself.
And remember, like, it's a wound that's inside and you need to take it easy.
Yeah. And then you can see like the different parts of the placenta. So it was a really cool science lesson for us.
That's cool. Yeah, for sure. So that's what you did. Yeah, I thought you said you did something like that.
But I think it's really cool. I'm not squeamish around blood or anything like that either. No. So some people might not enjoy that even.
Maybe just don't share it with everybody.
But I thought it was really cool. My kids did.
Keith was like, I'm not doing it, but I'll see your picture. You might think it's weird, but I don't care.
It's funny.
It was something that gave my baby life, and I didn't hemorrhage, and so I had it. It was all intact, and so I wanted a memory of it because I knew that was the last time. So yeah, I'm so glad I did it, even though it was gross and it smelled like dead whatever.
That's because you were refreezing.
Oh, it was horrible.
And refreezing.
He's like, why are you doing? And then Sophie would be like, open the placenta. And then we'd be like,
oh, gross.
And we'd be like, oh. I was like, Kay, take it. Put it on the piece of paper. It was so funny. And then getting a baby to like sit still. Yeah. It wasn't great. Yeah. I even put the picture in front of like the Christmas tree. That was a little bit weird. But anyways.
That's really funny.
Yeah.
Some people
That's funny.
like to bury it like in the ground.
I've heard that too.
It has actually a lot of nutrients and it is good for plants.
Yeah.
That is a fact.
Yeah, I've heard that
As
too.
weird as it may sound.
That's true.
I think there's I'm not sure where, so I'm not going to say it. But I think there's a few cultures that's what they do. That's
I've
like
heard
the
that.
norm. So they go find like a special tree or something and
Mhm.
they'll bury it in the ground and have a little, I don't know if they have a ceremony or just like a moment.
Yeah.
Yeah.
It's pretty cool.
So that's something else that some people will do.
Yeah. I think there's just so many things, and
Yeah.
it's just a way to honor it for bringing your baby into the world and feeding your baby. And
It's crazy that our body can create
It's
a temporary organ
an organ.
that's connected to a cord that's connected to the baby.
I know it's weird. Like, how does it grow a cord? Like, it's just, it's just crazy.
It's
All
really
of it. I
amazing.
remember being like, that came out of me?
Yeah.
Feels like you're an alien. It's weird.
The placenta.
Yes. The first time I ever had a baby, I was like, what? The placenta? No, the cord too. And I'm like, oh my gosh, that is so weird.
Yeah.
But it was the coolest thing ever. My son's placenta was so little. Like, it was so tiny. He was only 5 pounds, 11 ounces.
Yeah.
And so, like, he had a small placenta.
Oh.
Sophie's placenta was like a steak. And so was Lorelai's.
Yeah.
But Ben's was like... It was so little, and he fit in it. It was weird. I was like, how in the world did he live in that? But she showed me, and I was like,
it is crazy.
and note to self, tell your midwife what is the designated placenta holder, because I forgot to tell mine, and she put it in one of my salad bowls, and I may or may not still serve salad in there.
We did the same kind of thing.
See, she did the same thing.
Except ours was on purpose because
Don't
I
tell
forgot
anyone.
about getting a bowl for it last minute, and like I'm already in labor and we're waiting for everyone to show up, and I was like, oh crap, we need something for the placenta.
You're not thinking
And
about
Tom's like,
that.
he looks around in the kitchen, he grabs a wok. So we had this wok.
Oh my gosh. And we probably eat from it. It's fine. It's fine.
And so
Like
we
the-
literally put the placenta in the wok.
Yes.
And then like, I mean, we like sanitized it and everything after. We used hydrogen peroxide to clean it.
Of course. But like, it's just so funny. So
But it was hilarious. He's
Just
like, so
have-
we're cooking it up now?
just have a ice cream pail.
Yeah.
Or just a garbage bag if you don't want it.
Yeah.
Just don't stick it in your pots and pans, just in case.
Don't be like us.
Don't do what we did. And it's so funny because I tell everybody, I'm like, well, we're having a placenta bowl.
Placenta salad.
Could be. I don't remember which one it was.
Oh, I know which wok I use.
It's like, oh, I'm like, well, oh well.
Oh,
So anyways, yeah, we hope you enjoyed that. Maybe it was a little TMI, but that's okay. It is 12:30 our time.
It is. Yeah,
Oh.
we're a little crazy.
Slurring our words.
When the kids go to bed, moms want to party.
Seriously. Well.
Or just record podcasts, you know.
Yeah, exactly.
Okay, anyways.
Oh man.
If you guys haven't yet, make sure you subscribe, like, follow, share.
Mhm.
We really appreciate it.
Mhm.
And
we hope you learned something.
yeah, exactly. About
All about delayed cord clamping and how awesome placenta art is.
That's right. That wasn't even in our notes.
That's okay. It's the same thing. It's attached to the cord.
Exactly.
Anyways, thanks for being with us. Till next time.
What the mom?